Okay, I think we'll go ahead and get started. It's a minute past. Thank you so much for joining us today. Super excited for this family wellness webinar. So Dr. Chanel Cressman is a registered member of the College of Naturopaths of Ontario since 2011. After completing her undergraduate degree at the University of Guelph, studying food science, Dr. Cressman attended the Canadian College of Naturopathic Medicine in Toronto. Dr. Cressman holds a valid IVT, which is intravenous therapy license, has completed training for advanced integrative endocrinology, and has the ability to prescribe bioidentical hormones and is certified in first-line therapy, healthcare practitioner designed for weight loss management. Dr. Cressman has a particular interest in women's health and pediatrics. In 2010, she participated in the doula training, which is child labor support, through DONA International, and since has supported women pre, post, and during their birth experiences. Dr. Cressman treats families in her private practice with a particular focus on fertility, pregnancy, postpartum, and hormone imbalances. Outside of work, Chanel strives for a healthy balance in today's world with many priorities. Her interest in food and its connection to health is what led her to find naturopathic medicine. When not in the office, you'll find her cooking a new recipe or spending time with her family and friends. So really pleased to welcome you here, Dr. Chanel, and I'm going to go ahead and turn my video off. Just a couple housekeeping items though. If anybody has questions, please post them in the chat. I'm going to ensure everybody's enabled. There we go. Or you can also post them in the Q&A tab there as well. I'll kind of be checking both, and maybe easiest, Chanel, if we address those at the end. That's okay with you?
Yep.
Yeah, or whatever you're comfortable with. If you want to address them, it's fine too. Yeah, but without further ado, Dr. Chanel, I'll pass it over to you.
Great, thank you. Yeah, so you kind of heard my bio, a little bit of my background there. There instead of like, yeah, I'm a naturopath, I'm a clinic owner, so I have a clinic in Kitchener, and we're sort of a family-oriented clinic. So we see infancy all the way to full adulthood, and support patients with a variety of concerns. But today, this is something that's sort of my bread and butter, is talking about hormones. So the thyroid, adrenals, and the ovaries, that's sort of what I'm going to hash through. So we'll get started. So I put this slide up at the beginning that this is my disclaimer. So tonight is a chat about women's health. So I assume that everyone's kind of on board with the fact that my content is very much female driven, and men and women are just different breeds. So I kind of joke about, when we look at choosing shampoo, I was like, there's different factors that play in. And the same thing happens on a physiological level. A lot of the content that I'll say tonight is applicable to men, but it is, there is some variances, and those variances can be significant. So just kind of keeping that in mind. Why should we care? So to start things off, thyroid medication is among the top 5 prescription meds. So this means about 10% of the population is on a thyroid medication. That is massive. And this has been this way for a long time. And if anything, thyroid medication is creeping up. So 1 in 10 women is suffering with a thyroid condition. So that's really significant. And particularly in Southern Ontario, our hypothyroid numbers in particular are really high. And we're considered there's this belt where we are low in some of the nutrients that are required for thyroid production. So it's even higher for us. It's a big deal. Antidepressants. So antidepressant medications take up 2 of the top 10 most prescribed meds. So these fall under, are only after cardiovascular and thyroid medications. So again, we're talking about major players. And when I look at the adrenal glands, they're significantly related to mood. I really looked for a stat on this that was pre-pandemic and post-pandemic, and I couldn't find one. But I can only imagine that based on my clinical experience, that these numbers have done nothing but go up. So mood medications are really significant. So again, we're talking about big numbers of people. And then lastly, so 10 to 20% of couples will struggle with getting pregnant. And so That is massive, right? So 10 to 20%. And then if we broaden our category, when we're talking about ovarian dysfunctions here, 1 in 4 million women in Canada have PCOS. So that's another 5 to 10% of the population. Well, that's just one ovarian dysfunction concern. So we think about those dealing with a thyroid issue, an adrenal issue, an ovarian issue, we've got big numbers here. So it's a big topic and we should probably care. Oops, double skipped. So today I'm going to kind of go through a bunch of things. I'm going to talk about the healthy role and then the dysfunctional role of each of these organs. So adrenal, ovaries, thyroid. I'll talk about some testing. And then I'll talk about some treatment stuff. And my hope with the treatment stuff is it's things that you can maybe implement right away, or just even food for thought. Like, so some ideas of, hey, when I notice these habits in myself, that may be indicative of something that's a little out of balance. And that can be an opportunity to help reshift the scales. I'm happy for questions starting, but I'm also happy to wait for things for the end. So whatever works for people. So starting with the adrenal gland. So the adrenal, they sit right on top of our kidneys. So they're at the back here, and they produce what are called our steroid hormones. So steroid hormones all start with a cholesterol backbone, and I have a picture to show this right after. But basically, part of these steroid hormones is cortisol, which is the primary one I'm going to talk about today. Androgens, which is DHEA, is one of the big ones, and that relates to more of our sex function, and aldosterone. And so cortisol is a biggie. So when we think about being stressed out or having a stressful event, cortisol is the one that comes up. So adrenaline, which we often talk about, adrenaline is fast acting, so it goes up quickly and it comes down quickly, and that'll give us a little boost. But cortisol is our long-term hormone. So anytime that, if we have a stressor for more than 10 minutes, cortisol will start to respond. And the trick with cortisol is that once it gets produced, it takes a minimum of 90 minutes to come down. So that's significant. So if you have a stressor that persists for more than 10 minutes, maybe it goes away, but it takes a long time for that hormone to come back down. So that's significant. And that plays out in a whole bunch of ways that we're going to talk about here. Aldosterone is a hormone that plays a role in terms of water metabolism. So this is where we start to see an impact in terms of blood pressure, but I would also say swelling. So whenever I think about the adrenal glands, and particularly talking about their dysfunction, when my patients are coming in and they're telling me, oh, I'm really swollen by the end of the day, or I feel so, you get those creases from your socks, or your rings start to not fit, or things like that, that's a flag for me that maybe there's an adrenal dysfunction going on here, because aldosterone plays a role in that. So these are all kind of foods for thought. So normally when the adrenal gland is functioning well, our water balance is there, our cortisol or our stress response can go up, but it also comes down. And we would see this rhythmically. So that's a normal function. Our cortisol rises in the morning, we get perky and we wake up. It kind of stays steady during the day, and then it should come down at night to help us get tired so we can go to sleep. If that is not part of our pattern, that is a sign to let us know that that cortisol and that adrenal function is imbalanced. And so our symptom picture here with adrenals is pretty massive. So this is the one challenge with adrenal dysfunction is, oh, this could be a whole bunch of things. So this is a bit of a laundry list here. So fatigue, sleep disruption, weight issues, cravings, allergies, anxiety, depression, mood disorders, low blood pressure, high blood pressure, libido changes, fogginess or whatnot. So it's like, this is massive. This is a big laundry list, but hopefully you can start to appreciate that the importance of that cortisol and that adrenal gland really functioning well, because all of these things are part of that rhythmic pattern, and it plays out in so many different areas in our body. So again, this is another sort of visual to kind of bring that home. So if we have too much of that cortisol, so remembering again, more than 10 minutes, boom, cortisol's been produced, we can start to see some of that heart rate increase and the blood pressure increase. Well, that's that aldosterone hormone that I talked about. That's going to play in there. It impacts the kidneys and it'll change literally how much water we're holding on to. So our heart rate can go up, we can feel those palpitations perhaps, and our blood pressure rises. If we do that for too long, all of a sudden our metabolism can start to shift and we can have increases in blood sugar. Well, if our blood sugar goes up, we start getting way more cravings. And this is particularly often like sugary foods or fast acting foods, because that's our body's trying to make more energy because we've had a stress come onto us. So that blood sugar can go up, we start craving things more, and that shifts our metabolism. So now all of a sudden we start to see weight changes and how we hold our weight changes. So yeah, so that's that metabolism piece. And then we goes into playing a role in terms of our ovarian function and irregular menses. So blood sugar is directly related to how our period flows and how our ovarian function functions. And so that can start to play into that irregular period. And PCOS, so polycystic ovarian syndrome, is a prime example of this. So with PCOS, the other term that we can often refer to it as is diabetes of the ovary. And it's where this blood sugar dysregulation starts to shift the metabolism and it causes irregular periods. So it's a direct connection between that adrenal function and ovarian function. I'm going to repeat a lot of this stuff, so hopefully it'll all kind of layer in and make a lot of sense. So this is the picture I'm going to show multiple times to kind of bring it all together, hopefully. But I want you to take note that that cholesterol is that top corner. So like I said at the beginning, cholesterol is the backbone to making all of our steroid hormones. And so I highlight this because we need fats, and particularly as women, we need really good fats because we need to make all of these hormones. And if we don't have, I am not a fan of low fat diets. And so because cholesterol is really important to making all of these things. So particularly when I'm thinking about the adrenal gland, cholesterol will go into making that aldosterone and that cortisol. So that's pretty important to make that link. And to understand that in order to make aldosterone and cortisol, it goes through making progesterone. So hopefully this is just going to start to show all the different connections between these hormones. So the adrenal glands are helping to produce this, but it's going through progesterone, which is made in the ovaries. So what impacts stress? So if we're talking about, we've got a healthy adrenal gland or an unhealthy adrenal gland, how does that get impacted? Well, one thing, and you might already know this, is that whether it's real, perceived, psychological, or physical, that stress response is the exact same in the body. And I always highlight this because we don't have to have anything real hit us. But if we are living in a state of fear, if we're living in a state of anxiety or stress, that will bump up our cortisol levels just as much as getting in a car accident, where there's a real physical stress kind of going on. So this is particularly, as I'm sure you can all appreciate, been brutal during the pandemic. We've just gone through several years of so much fear, so much stress, in multiple ways. And so this has been huge in what I've seen in my clinical practice in terms of that adrenal gland function or dysfunction, really, because that stress has gone up. Other factors that can impact stress, aging, well, we don't have much control over that, but just to acknowledge that as we age, that curve, that up and coming back down of that cortisol is impacted, and it gets slower as we age. So we just can't respond quite as quickly. Food, alcohol, caffeine, stimulants, so things like MSG, caffeine is like a big one. Like we all love our coffee and our Java to get us going in the morning. Sugar is like a food that can impact that stress and that cortisol production. So all of those, some of those can be really like impactful in that we can have a change on them. So, but they're good to know. Working long hours, lack of bonding, poor sleep. I bolded this one because again, this is something that I think has been really disrupted during our pandemic. So we've had wonky hours, poor routines. We haven't bonded with each other. Our sleep patterns have been disrupted because we're working and stressed out in different ways than we were before. This is massive. Our adrenal gland really needs routine and rhythm to function well. And this has been massively disrupted. So that is huge. Pollutants, chemicals, these are disruptors for an entire endocrine system, but particularly for our adrenal gland. So I say all this not to be like doom and gloom, but to just give you a sense of like, okay, well, some people might be more sensitive to, you know, stimulants or caffeine versus the other person. You know, if they get out of their sleep function, then that's going to be more impactful. But there's a variety of things that can kind of build up into making our cortisol and our adrenal gland function well, but also disrupting it. Okay, so that's the adrenal gland. Ovaries. So our ovaries are located in our pelvis. They secrete our sex hormones, so estrogen, testosterone, progesterone. Particularly for women, we talk a lot about our estrogen and our progesterone, but testosterone, as you'll see in my picture, testosterone turns into estrogen, so it is very important in that entire cascade. For men, this is part of where my disclaimer that testosterone is more impactful, but it is still impactful for us as women. Our ovaries release, store and release all of our eggs. So when we're talking about fertility and baby making, that's important. And this requires stimulation from the pituitary gland, which is in our brains, in our heads there. So when our ovaries are functioning well, everything is tickety-boo. But I love doing period problems because these are significant times in our life. Like if we think about it as women between puberty, our fertility years, and then perimenopause and menopause, that is a massive span of a woman's life. And so I think about these times, and if I can help women transition through these stages well, with as minimal symptoms as possible, then I have significantly impacted her life. So when our ovaries are functioning well, all of those transitions should be going as smooth as possible, and that's significant. When our ovaries are not functioning well, we can have a whole list of symptoms. So PCOS, as I mentioned before, so polycystic ovarian syndrome, this is when we have irregular periods, making babies really tough, can cause like weight gain in areas that we don't want, things like that. Premature ovarian failure, this is becoming more and more common, where women are entering menopause earlier and earlier. Anovulation is a lack of a period. That can happen for a whole bunch of reasons. Ovarian cysts, fibroids, irregular periods, infertility. The list kind of goes on. But a lot of times, so these are like official sort of diagnoses of things that can happen with an ovarian dysfunction. But a lot of times what will drive someone into my clinic is, you know, brain fog, period pain, heavy period. It may not be as diagnosable or a particular label like that, but any of those cyclical symptoms that are happening there, if you're suffering, you know, 2 weeks of every month because you've got headaches and migraines and cramping and diarrhea and things like that, again, significant time of a woman's life. And that's also an indication that there's some kind of dysfunction going on, often between estrogens and progesterones, that's perpetuating this. So again, I pull up this picture to start kind of putting the pieces together. So cholesterol, again, really important to be having that as our backbone. Oops, sorry. Yes, cholesterol, so that's our backbone there. So it goes on to making progesterone, but then progesterone can come over to making DHEA and then testosterone. And testosterone goes down into making our 3 types of estrogen, E1, 2, and 3. And E2 or estradiol is our most potent or sort of active estrogen. So when we're looking at hormone testing and things like that, that's the one that we typically want to look at. But again, this goes to show that, okay, if cholesterol is our backbone, if we don't have enough cholesterol, we can't make any of these things. But as I'll start to layer in, well, if cortisol is really hungry, and is demanding, it might start to pull away from progesterone. And if it pulls away from progesterone, then all of a sudden we're going to start to have some of these imbalances. So you can start to see, because they're all part of the same pathway, that they may all, that they're going to interplay. Hopefully that makes sense. So thyroid, this is our third organ function here. So the thyroid sits here in our necks. It is really important in that the thyroid, basically, it is the metabolizer, or I kind of say it's like the lights and the power to the whole house. So when our thyroid isn't functioning, or if it's low function, it slows everything down. And if it's over functioning, it speeds everything up. So our thyroid is kind of like the powerhouse turning on our hormones, but a variety of other things as well. It's worthy to note that it requires iodine and tyrosine to make those hormones. And so we need those ingredients. And this is where, particularly in Southern Ontario, we have low iodine in our soil. And so we see this hypo or under functioning of thyroids, particularly because of some of this nutrient deficiency stuff. So just noteworthy. When we think about, so hyperthyroidism does happen, but at a way less frequent rate than hypothyroidism. So hypothyroidism is that underactive thyroid, and this is quite common. So my stat from the beginning of 5%, 10% of women being on a thyroid medication, it's for hypothyroidism. And when, like I said, so if the power starts to turn down or shut down, we see the slowness in metabolism, which translates to, again, a whole laundry list of symptoms. So dry skin, because the turnover isn't happening as well, cold intolerance, inability to lose weight, constipation, slow thinking, puffiness, coarse skin, blood pressure changes. So these are everything, the whole system is kind of shutting down. And that can be signs of that hypothyroidism. So this is really common. Again, hard to kind of diagnose without testing or whatnot. But when you're starting to see a whole bunch of these things, worth thinking about the thyroid. Factors that can impact the thyroid, again, there's multiples here, but high cortisol. So again, starting to see these connections of this triad and how they interplay. But if our cortisol is up, it shuts down our thyroid. So it's an unfortunate combination, but as we get more stressed out, our metabolism can slow, particularly just through that thyroid function. If we have low progesterone, so then this is where we start to see that ovarian impact, right? So if our progesterone is low, we need progesterone to turn on our thyroid. So all of a sudden, our thyroid function isn't as great. If we've got low nutrients, as I mentioned, so selenium, zinc, trace minerals like the iodine, all of those can impact our thyroid function. Heavy metals and autoimmunity. So these are things that the thyroid is a really sensitive organ. So if there's any toxicity and whatnot, we often will see it more impacting organs like the thyroid. So sometimes if I don't see things move, for example, with a thyroid condition where I would expect them to, I might start looking to say, hey, is there some exposure or toxicity going on? And then of course, genetics. So I'm sure you've seen this in individuals that that, my mom had a thyroid condition, my aunts had thyroid condition, and then an individual has a thyroid condition. So there is a genetic piece as well. So then when I think about this big picture, so again, to kind of all tie together, the brown outline there is basically ways in which that thyroid kind of turns those hormones on. So the thyroid isn't directly responsible for making any of these steroid hormones, but it will impact their rate of production and sort of, like I said, that power piece. So yeah, so hopefully we're all kind of starting to tie it together. And so again, tying that whole picture, when I think about hormone disruption, there's a whole bunch of factors. And I kind of look at this again, not to be doom and gloom, but to give people a sense of the pieces of the pie. And when I'm working with patients, I will often say, okay, well, what are areas, which pieces of the pie can we manage or can we look at and impact, right? And sometimes it's just helpful to be validating, to be, okay, head trauma is one I always put under there, that I'm like, post-concussion, hormonally, things can really change. And so I'll ask people, I'm like, hey, have you had a concussion, multiple concussions? Did things change after that point? And if that's a thing, or if that, times up in their history, I'm like, that will definitely play or can play a role in terms of their hormone dysfunction. And it's something that we don't often connect or link, right? Genetics, as I said, medications for sure, environmental chemicals. So, unfortunately, this is like my big shtick about like plastics, for example. Plastics are often hormone disruptors. We cannot avoid plastics, but can we minimize them, right? I don't know, maybe that's realistic, maybe that's not realistic, depending on your lifestyle. Sleep, okay, great. If you've got an infant at home that's mucking with your sleep, that's going to be a pretty hormonally disruptive time. But are there ways that we can work at improving sleep? Or, as we age, so aging is part of it, but as we age, we start to lose some of that rhythm. So that plays into that cortisol production. So all of these factors, these are pieces of the pie, and we kind of pick and choose, okay, which ones can we impact? So to kind of sum and tie everything all together here. So, our thyroid and our sex organs, they're required, right? So the thyroid is required for metabolizing and the rate at which we make our estrogens and our progesterones. But then vice versa, we need progesterone in order to make what's called T3 and T4. So the converting our inactive thyroid marker to an active thyroid marker. So we need progesterone to turn that on. So there's a two-way relationship there in making sure everything is balanced. When we talk about thyroid and the adrenals, well, if the adrenals, they pull back cholesterol, right? And they, to make cortisol and aldosterone, that will play back into that pituitary, so that brain. And if that isn't working properly, it will inhibit that pituitary function. So if that's feeding back to the brain and shutting things down, now that pituitary isn't going to tell the thyroid to do its job. So now all of a sudden it's impacted it. If it turns off the thyroid, it slows our methylation, which is our metabolism, and how we break things down. So again, we've got this double whammy of sort of turning down the power and shutting things down. There can also be spasms in fallopian tubes, and that will all play into it. Then again, so it's like, if our sex hormones are functioning properly, we start to get altered metabolism and fat accumulation there as well. We often see this postmenopausally, where women's bodies will often shift and they'll hold weight differently than they did before. We can have increased inflammation. We see altered sex or sleep patterns, with the adrenals and the sex organs. So hopefully this is not overwhelming, but just starting to show you that none of these organs work in isolation, and they all, so this is why I call them that triad, right? They all interplay, and you need one to support the other in order for all of them to function. And particularly at these hormonal transitions, so period, fertility, menopause, we start to see impacts to all three of these organs. And that's where some of these often disruptive times can happen. Oops. So I hope that kind of makes sense in terms of healthy role, dysfunctional role of the adrenals, thyroid, and ovaries. So I'll get into a little bit of testing here. So this is a test called a Dutch test. So it's dried urine testing of cortisol and hormones. That's what the Dutch stands for. And I like this test. It's one option, or it's one example of some hormonal testing. So what I like about the Dutch test, so like again, dried urine, so it's a urinary test, and it looks at the metabolites, or how your body's broken something down. It lists everything in these massive tables. And it also does a whole bunch of graphics. And so what I like about this test is, like I said, it's metabolites, so it's how your body has broken down. So it's a little less variable than something like blood testing. So blood testing has its value and purpose, but blood testing is challenging because if you tested it now and then you test it in an hour, it's going to be different. So we have to use that, take that with a grain of salt. But metabolic or urinary testing is a little bit slower to change. If we test it now or in an hour, it wouldn't really be different. And so, yeah, so I like using it. I like using this for a sense of where my hormones are sitting at. These pictures of this picture here is a great example of cortisone and cortisol. So for example, these are the pre and post breakdown of cortisol. So we have cortisol, which is the active molecule, and cortisone, which is its breakdown or metabolite. And so this is an example of the cortisol is on the low range or low end of normal, but the cortisone is under. So it's not being broken down very effectively. So this is one marker or one way that I can see, okay, what is my patient's hormone level, but also how is their metabolism functioning? And so this can help me kind of say, let's check out the thyroid, let's look at other ways to help in terms of detox or metabolism and breakdown. This is also part of that testing. So again, we do these like pinwheels, but this is an example of looking at the 3 estrogens. So when I'm looking at my screen, it's on my left side there. So E1, 2, and E3. So the number in the middle is the patient's number, and then there's the dial. And so the green part of the dial is considered normal. Between the 2 stars, anything low is too low, anything high is too high. Hopefully that makes sense. But this is an example of a patient who all 3 of their estrogens is off the chart. So she's got high estrogen levels. And then as I go down into how she's breaking them down, she's actually not breaking them down. So her metabolite levels are really low. So I know exactly where the kink in the chain is that I can be helpful for her in terms of not necessarily decreasing the production of her estrogen, because estrogen is so protective and important, but I do want her to be able to break it down and get it out of her system, right? Because we're making this stuff every day. So this is a type of testing that I think can be really valuable for the hormone level, but specifically for how our bodies are metabolizing these things. Blood testing, like I said, there can be really great blood tests that we can use. I find serially, so if we're doing multiple tests, particularly with my fertility patients, they'll work with a fertility clinic, we'll test them every few days to see what their numbers are at. That is really helpful when we're looking at like estrogens and progesterones. A one-time shot of an estrogen or progesterone isn't always that helpful. Again, depends on the case for sure, but a lot of times it will help me diagnose if there's something significant or abnormal going on, but it won't really give me a sense of where's their hormone at. So I always try and educate my patients of, okay, well, why are we doing this testing? What information is it going to give us? But other blood tests that I do really like is like this top one, TSH, so thyroid. So I want to test the thyroid and see where it's at, because as we talked about, there's a laundry list of symptoms that can go with thyroid dysfunction. So how do we know? So testing is really helpful. But then I also put a couple of these other ones on here. So C-reactive protein, this is an inflammatory marker. So it doesn't tell me her hormone, but it does tell me, is it starting to impact other areas in the body? And in this case, yeah, it is. Her inflammation is through the roof. So she's got joint pain and just generalized achiness that's slow to recover. Okay, well, I can rule out that her thyroid isn't the problem. But if I start digging deeper into her estrogens and progesterones and whatnot, I'm like, we got a problem here, right? Vitamin D, I always test. I mean, this is a great time of the year to test vitamin D because everybody's low, because it's been the longest we've had without any sort of sun. But vitamin D is so important. If our vitamin D is deficient, we can't metabolize and break down our estrogens in particular. And so, okay, that's a really, what I say, an easy fix. So let's test your vitamin D, make sure it's in a healthy range, because not only will that support your mood, protect your bones, manage your calcium levels, things like that, but also it's going to ensure that your estrogen production is effective and you're metabolizing things well, so that we stop with the period problems, right? So this starts to be quite important. And then the last two marks I've got on here is glucose, which is our blood sugar, and then hemoglobin A1C, which is your average blood sugar over the last 3 months. And again, at a 5.9, I'm like, okay, this isn't a diabetic, but this is sort of an early warning sign that there's some blood sugar dysregulation. So non-diagnostic, but a dysregulation. And that makes sense. She's inflamed, she's got cravings, she's just not feeling well. And these are all those signs of that dysregulation. Oh man, sorry, I keep doing that. Okay, so we kind of chatted about that testing. Now, what do we do about it, right? So we've got a doom and gloom to everybody. Here are all the signs or things that could go wrong. How do we fix it? So I always say, like, as part of my bio, my intro said, I was like, I love food. I love eating food. I love making food. I love sitting around a table and chatting about food. So food is totally what got me into naturopathic medicine. And I think it's so interesting because food tells us a lot. So when I look at these grocery carts, maybe they look familiar, but these tell me two different things. So on the left-hand side, the nibs, the Coke, the Doritos, we've got some stimulants here, right? We've got some caffeine, we've got some sugar, we've got some MSG. So this is a patient who's really looking to get some stimulation going because that, oftentimes that cortisol function is low. They're feeling burnt out and tired, and they're looking for that next boost. Now on the right-hand side here, we got the bacon, we got the bread, we got the brie. We've got some of those high-fat foods, and I was like, okay, this tells me something different. This is more resonant with a patient who might just be low across the board because she's craving that cortisol, she's craving those fats, and all of her hormone function might be a little bit lower because she just needs more of that backbone to get things up and going. So it's like, so we can often just, let's first talk about, like, well, what are you eating? What are you craving? What's going on there? Because that can give us a lot of clues. And then what should we be eating? We probably all know this. And the trick is, how do we get from that grocery cart to eating the rainbow? And that's where it's fun to kind of work with individuals. But at the end of the day, we want to be eating the rainbow. So the more color you can add to your life, you are winning. So high micronutrient content, cruciferous veggies. So these are things like broccolis, cauliflower, cabbage, kale, Brussels sprouts, any of those that you're eating raw specifically have an ingredient called I3C, indole 3 carbinol, which helps our hormone metabolism. So get some broccoli in there, get that coleslaw going on the regular. These are some simple things that hopefully you're like, okay, cool. I'm going to make that bagged kale salad with the poppy seed dressing. I was like, that's going in my grocery cart every week, right? So just making some of these hopefully small but significant changes can be impactful. Enjoying healthy fats. So like I said, I'm not a fan of low fats. Fish, omega-3s, olive oils, avocados, nuts, seeds, nut butters, all of those are awesome healthy fats. And as women, we need fats in our diet. So I am not a fan of low fat, no fat. As like, eat your fats, but eat good ones, right? And generally when we think about good ones, I think about fish and veggie sources. We don't have to work to get our animal fats in there. We've got them in, so you don't need to try, but we might need to try on getting enough fish. We might need to try on getting enough nuts and seeds, those types of things. And then minimizing the junk. So minimizing the stimulant. So are you a 4-cup of coffee kind of person? Cool. Can you drink 2 and then switch to green tea? How much salt are you adding? Are you a big Doritos fan? Okay, cool. Can we switch to a chip brand that doesn't have MSG in it, right? Like, what are some of these? Sugar, it's a biggie, right? So how do we minimize these? They're not going to go away for most of us, but we can work at minimizing, or at least being mindful of, like, well, what does this tell me? What am I trying to get out of this stimulant, right? Lifestyle wise, sleep. Sleep, sleep, sleep. Sleep is so undervalued and it is so important. And if I can say sleep and sleep in a rhythm. So shift workers are like the obvious ones that they literally have shorter lives than individuals who are non-shift workers. So the more rhythmic we can be with our sleep, so going to bed at the same time, waking up at the same time, massively impactful across the board. So sleep, totally. Movement or exercise, this is huge. We all hear this all the time. And my husband, I give him credit that he has coined the term accidental exercise. And he is great at this. He is good at biking places. He just walks to catch the bus. He just walks, like he's just moving around, right? And so this is it. So it's like, if you are someone who likes to schedule and get your exercise in a more intense ways, amazing. But really, we just need to move. And the pandemic was really bad for that. We didn't move for the last 3 years. So if I can motivate anybody, get moving. Deep breathing, meditation. This is so lame sounding, but it is significant. So the trick I always tell people is hand on belly and back and count for 5 to breathe in and count 5 to breathe out. Cheesy, but free. And that is the beginning of changing your cortisol. So as I said, that stressor that goes up and it's hard to bring that down. Within a 10-second breath, so 5 in, 5 out, you will switch your adrenaline from being on to off. And that's our fast signal. And that adrenaline has to come off before our cortisol can come down. So it's simple, but doing deep breathing before each of your meals, like boom, right? Like pretty easy, but really impactful. And then I think about the questions on the lifestyle stuff of what's the right pace, what makes you happy. Yeah, I think we maybe forgot some of these things, particularly in the last few years. Supplementation. Again, this is a bit of a laundry list, but I kind of throw it up there to say there are tons of things that can be helpful. I use lots of supplements in my practice. I think they're awesome. Herbs are awesome. I think nutraceuticals, which is really like extracts from foods. So like I was saying, I3C in that ovary category, that's from an extract from broccoli, massively helpful. So I think these things can be really helpful. The trick is kind of just having someone to guide you through it and figuring out which combo or which one is going to be most impactful. But I throw this up to let people know that like, I think there's lots of options when it comes to supplementation. Other stuff. Bioidentical hormone therapy. So knowing that as naturopaths, that's like in our wheelhouse, that we can do hormone replacement therapy, but instead of it being equine or horse-based, it's plants. So the impact is significant, but it's a little bit gentler in terms of metabolism and breakdown, and we see less sort of side effects. So shocker, I'm a fan of that. IV therapy is something that I do, so that's what this picture is. So it's making little nutrient bags. I think this is awesome. It's basically a way for me to boost people nutritionally. So particularly with that like chronic fatigue or adrenal burnout stuff going on, I'm often using a lot of IVs just to upregulate. Acupuncture, awesome for stress management. I use it a lot with my fertility patients, really powerful when helping to regulate cycle. These are great options. Homeopathy, it's more of an energetic therapy. I find it really helpful when things just are like stuck. Like if things aren't moving in the direction that I expect them to go, I'll often turn to homeopathics to kind of shift things. Yeah, relaxation, massage, they can all be helpful for stress management. So there's lots of other tools. And I think the trick always is just like, well, which tools fit in your toolbox? So figuring out that kind of individualized combo. So in summary, no hormone works in isolation. Our triad is important. So adrenal, ovaries, thyroid, they all work together, which means that piece of the pie. We can start with one piece of the pie, but we kind of need to look at the whole thing to make sure that we're getting everything in check. There's lots of ways to support. So it's like, diet, talk about lifestyle, but then all those other things that I listed there too. I think small changes can really be impactful. So hopefully it is, motivating or encouraging. That is like just even thinking about the deep breathing stuff is like powerful and can be really powerful. And then I throw in there like testing. I was like, sometimes you need testing to just tell you what is what, right? Because lots can be going on. So know that there's some tools and some tests out there that can be really helpful. And that is it. Oh, and there's questions. Okay.
Yeah, can you see them? Janelle, you want to read
Yeah,
them?
so sorry. Q&A. I'm in my early 40s, but had a hysterectomy, so I don't have the natural indicator for signs of menopause or hormone changes and disruptions. What other indicators should I be looking for? Great question. So yeah, so with a hysterectomy, obviously you're not having a period. So you don't get that monthly marker, but you can, depending on the person, sometimes you may still have cyclical symptoms. So what I would throw out to this individual is think about, is there anything that's happening on a monthly basis? So are there mood changes, for example? Are you getting headaches? Are you getting bowel changes? So, like, oh, at the end of the month, I always kind of get this like couple days of loose stools for a while, or a couple days of constipation, anything like that. So often I think about those PMS-y type symptoms, which can be fairly broad, but any of those things that are happening in a cyclical manner. And then I would also say, this is where testing can be really helpful. So particularly if there's like fatigue stuff going on, if there's hair, skin changes, any of that stuff, you probably will need to shift to doing some testing sooner, perhaps than an individual who still has their uterus, because you just unfortunately don't have that monthly marker. But there could still be, but testing can still be a really good option. I hope that answers that. Could you repeat the part about deep breathing for 10 seconds before eating a meal? I didn't catch what the benefit of that is, and I'm curious. Yeah, so with the deep breathing, so the way, there's lots of ways to do deep breathing. Meditation apps are often part of this, but a simple way is I say, put your hand on your belly and your back and breathe in. And the belly and the back is so that you can feel the expansion and then contraction. And so you do 5 seconds of in and 5 seconds out. Right? So you're getting that deep breath, so not in the chest, in the belly, and doing that breathing. And the benefit to that is it shifts your adrenaline. And so adrenaline is that, it's kind of like fast cortisol. So it can help chill out those adrenals and bring down that stress response. So if we're in a tizzy or fussing about something, doing some deep breathing, really powerful. But a lot of times I'll tell my patients, I'm like, pair it with something you do every day, which is typically meals, right? So some individuals are still doing things like prayer or a reflection before a meal, but a lot of people aren't. And I would suggest do deep breathing, do 3 deep breaths before you eat your meal, right? Bring down that cortisol, chill yourself out. And then you can actually receive that food better because you're in a rest and digest state as opposed to a fight or flight. But then that's also going to have longer term impacts in managing that cortisol. I hope that makes sense. Do I offer any webinar series specifically focused on menopause? Actually, so my colleague, Rachel, she has a webinar on our website on sproutwellness.ca. We have a small library of some webinars that are all for free. So there's one on menopause on there. So you're welcome to check that out. And I was gonna say, if you follow us on Instagram, we'll often link to, my colleague runs a menopause focused webinar series. So unfortunately it's not myself, but my colleague does. So if you connect with us through Instagram or on our website, then yes. Just finished blood work and urine collection. Everything came back within normal limits. My endocrinologist told me that there isn't anything sticking out, but I feel in my gut that there is something wrong. Any suggestions? Yeah, so I think this is a tricky and really common scenario. So this is one of my, I would say, challenges with good and the bad with blood work. So with blood work, for things to be out of balance is diagnostic. And I often think of our medical doctors. Medical doctors are really good at making sure we don't die, right? So they're really good at preventing a diagnosis. but they're sometimes can fall short in keeping us feeling well. So this is often the difference between, okay, great, there's no diagnostic here, but you're still not feeling well. So I think this is, and I'm biased, but I think this is where naturopathic medicine can really fill in those gaps. So great, you've worked with an endocrinologist, you've done all the background work to say, hey, there isn't anything scary or red flag from a blood and urine perspective, but that may still, you're within reference range, but things may still be out of balance for an optimal. And I think this is where a naturopath might use things like the Dutch testing. So this is where we can say, okay, you're within range, but this metabolite versus this metabolite isn't working. So it's still fine, but this one's on the upper end and this one's on the lower end. So we can look at that minutia. And I think the metabolism is really helpful because yes, it does relate to the estrogen or the progesterone, but if you're not metabolizing well, that's going to have a multitude of sort of impact. So I think some different testing that is not offered through an endocrinologist can be helpful, but I would also say bias. I think naturopaths are really good at taking your symptom picture and putting that into some context. I hope that helps.
Yeah, amazing. Just to piggyback on that, Dr. Chanel, I just wanted everyone to be clear on that. So the testing that you were talking about, like the Dutch testing, is that typically only available with like a naturopathic doctor or more integrative medicine clinics?
Yeah. So family doc often it won't look at that type of thing. So an endocrinologist, so this example is like an endocrinologist will do blood testing or serum testing. And like I said, that's really good if you're diagnosable or out of range. But the reference ranges are massive. So depending on, estrogen's a great one, but I was like anywhere from double digits to triple digits is normal. But you're like, that's massive, 20 to 800. Well, there's a range there, right? And so this is where I think, great, that endocrinologist is doing a really good job to make sure that you're not going to bleed out or, that we're not dealing with an estrogen cancer or something going on here. But they may not have some of the time or the time really to go into the subtleties of, okay, well, there's still some symptom stuff going on, and how can I utilize your symptom picture with that information, say, okay, this is on the lower end of things, plus with this, just taking that big picture and putting all the pieces together.
Right. Yeah, definitely. Looking at patterns, really, right?
Yes, thank you. And yes, sorry, to your original question, is like the Dutch is primarily through naturopaths, or there's some like MDs who will practice sort of a bit more out of scope, more like naturopaths, and they would do it as well.
Right. Oh, I think we had another question come in there.
I had a hysterectomy at age 26, then took hormone replacement therapy for 20 years, and now I'm off all meds, but have weight gain, hair loss, sleep issues. Any suggestions? Yes. That is tricky. So I would, depending on sort of like the reason for the hysterectomy at age 26, again, I'm going to make some assumptions or some judgments here, but I was like, depending on what was going on at age 26, perhaps there was some underlying, whether it be like genetic or whatnot factors that I'd probably look at, like, what are your detox pathways like? So something like the Dutch testing, for example, I can still do with a woman who has a hysterectomy. I can still do with a postmenopausal woman because, again, it's giving me that breakdown picture. So I'd probably start with basic blood work. So things like, okay, if you're having weight gain, hair loss, sleep issues, is this thyroid? So let's test the thyroid. You could also look at doing some hormonal stuff. Hormonal meaning estrogens and progesterone testing, but I'd say probably some testing would be very much warranted. And depending on how quickly you came off those medications, you may need more support. So you may need to actually go back on some of that hormone replacement in smaller doses for a period of time to help the body adjust. Because really, when we're looking at estrogen is so protective and generally makes us as women feel really good. We need it in balance, of course. But this is a scenario when you've had a hysterectomy, I'm assuming you still have your ovaries. Yeah, you get this quick shift in the hormones, and that quick shift is what makes us feel horrible. So yes, you're on it for 20 years, but then you still need a weaning down time. And if that weaning down doesn't feel good, there's probably some detox processes that need to be supported. So test thyroid for sure. But then also potentially look at some other testing and broader spectrum on supporting those hormone metabolism processes.
Yeah.
I hope that helps.
Beautiful.
Am I missing? There's one in the chat. Oh, no. Okay.
Oh, no, that was just me.
That was typed in the Q&A. Cool.
Yes. Another quick question from me. I know near the beginning of the presentation, you mentioned iodine being low in Southwestern Ontario. So would you recommend supplementation of iodine for general thyroid health, or is it more nuanced than that? Yeah, it depends.
So if there's a thyroid condition, I was like, yeah, sometimes iodine support or supplementation can be like really easy, really cheap, and really effective. If there's any autoimmune stuff, we want to be careful because it can be a bit of a fire. And I was like, the fire, sometimes you need fire, but you got to be careful with it too. So yes, often what I find, particularly for my hypothyroid patients, is sometimes they're being uber healthy, and so they won't eat, they're not adding, all of our table salt is iodinized. So if you are using table salt, you are getting iodine. But a lot of patients that will come into a naturopathic office aren't adding salt to their meals. And so sometimes it's as simple as like, we could add iodine, but I'm like, maybe you just need a little more salt in your food, in your that kind of stuff. So sometimes there's these subtle ways to just get it in without actually adding the supplement. But that's my long-winded way of being like, yeah, iodine can be really helpful, but again, we just have to be careful about dosing. That's all. Yes, right. And that's not a conventional test that's usually run, right? Looking at iodine levels, typically speaking. No, so you can do some iodine testing. Often I will just work with people to kind of start low and slow and build up and be like, cool, let's, instead of testing iodine, I'll either test thyroid or I'll just go based on symptoms. Right. Okay. Makes sense. Well, we're almost at the hour. I think that's, let me see if there's any other questions. No, I think we're good. Perfect. Well, thank you so much, Dr. Chanel, for your insight. Yeah, I feel like we could just keep going. This is a big rabbit hole. Lots of information. I know it was amazing to learn a lot of this. And if it feels like it was an overload of information, we've recorded this. So we will be sending out the recording probably within the next few days if anybody wants to rewatch it or they're watching it on the replay. But you put up all your contact information there. So that's wonderful. People know where to find you. And just thank you so much for giving us your time tonight. Really appreciate it. I think we all got a little bit of it. All right. So everyone have a wonderful evening. Thank you so much for joining us. Take care. Bye.